this disease process. And that's why we have with us the experts on breast cancer with us in the studio, Dr. Allison DiPasquale and Dr. Priya Kannan with us. You can be part of the conversation by calling into the studio. The number to the studio is 972-235-5555. Once again, the number is 972-235-5555. We'll be happy to take your calls live throughout the show. Dr. DiPasquale and Dr. Kannan, thank you very much for being with us this evening. Would you please introduce yourselves to the listeners? Dr. DiPasquale?
Thank you, Dr. Shri. My name is Allison DiPasquale. I am a fellowship-trained breast surgeon. I practice out of Methodist hospitals and am part of Texas Oncology and Texas Breast Specialists. For more information about me or the services I provide, you can go ahead and take a look at texasoncology.com or any of the Methodist health centers. Thank you.
Thank you, Dr. Makadia, and thank you, Shri, for this opportunity. And it's a wonderful forum for us to convey our thoughts, and it's a wonderful service that you guys provide for the community. Thank you again. My name is Dr. Priya Kannan. I'm a board-certified hematology oncologist. I've been in practice about 11 years. I practice out of Methodist Hospital, and as you may guess, I treat all adult conditions with oncologic and hematologic. And more information, you can find it on our website at texasoncology.org.
Excellent. Thank you, Dr. Kannan and Dr. DiPasquale, for being on our show today. We're truly honored and appreciate it. Let's get right to it. Our first question is for you, Dr. DiPasquale. Can you explain to our listener what are the certain signs and symptoms of breast cancer? And once someone has been diagnosed, what are the necessary steps to take thereafter?
Thank you, Dr. Makadia. This is an excellent question. So, the signs and symptoms of breast cancer are really silent. Breast cancer does not hurt. Breast cancer does not cause pain. In fact, the signs may be not there. They're only seen on mammogram, on imaging, and that's why it's so important that women go out and get their screening mammograms, because you may not know you have a small, tiny, sub-centimeter cancer that's only seen on imaging. That said, as cancer gets larger, you can feel a palpable lump or something that you can feel in your breast that may feel similar to a BB or a P. So it is very important that although screening mammograms and going into your imaging is important, women should still continue to do their breast self-examinations because you know your breast the best. So really get involved in that. Once you have been diagnosed with breast cancer, the necessary steps are to continue with your healthcare team. Your breast cancer surgeon, your medical oncologist, they will provide you with the tools and complete treatment plan to cure your breast cancer. As we all know, breast cancer is highly treatable and highly curable. And that's what I want women to hear today, is that this is the message we want to get across. Early detection equals early cure.
Awesome. Thank you, Dr. DiPasquale. Dr. Kannan, what are the types of breast cancer, and is there one that is very challenging to treat, and are all breast cancers the same?
Excellent question. All breast cancers obviously are not the same. The most progress we have made in breast cancer, and the reason for that is we have had more women enrolled in clinical trials. And to broadly say, there are three subtypes of breast cancer. You have the hormone-positive breast cancer, which we commonly see in postmenopausal women, which tend not to be as aggressive and generally treated with, the surgery, the radiation, followed by the pills. Then you have a second subset called the HER2-neu positive breast cancer, which is driven by the HER2-neu gene. It is an epidermal growth factor, and sometimes, and that can actually be targeted with agents such as Herceptin and pertuzumab. It tends to be the second most aggressive breast cancer. The most challenging breast cancer is called triple-negative breast cancer, which we see very commonly in Hispanics, African Americans. Very aggressive. It is triple negative in the sense that the hormones are negative, ERPR negative, HER2-neu is negative, and typically tend to be treated with chemotherapy and tends to be very aggressive.
All right, Dr. Kannan, let's take a live call. Talk Live, what's your question for the expert? Hello? Yeah? Sorry, so right now we are talking about breast cancer. Do you have any question for the experts on breast cancer?
Yes, but this is a health show, so you have to call in later time. Thank you. Let's continue on this topic of breast cancer. Folks who are joining us, we are talking about breast cancer, and the number to the studio is 972-235-5555. Dr. DiPasquale, how often should women get mammograms, and can you tell our listeners a little bit about the new 3D mammograms?
Yes, so women should start getting normal screening mammograms at age 40 if they are of normal, high, or not high risk. So high risk women include women whose mother may have had breast cancer at age 40, and they should start 10 years prior to their first degree relative. If you have no strong family history, then go ahead and start at age 40. You continue with that on a yearly basis, because mammograms are not just a point in time. They're a comparison from one year to the next that really helps delineate if there is a cancer brewing or not. And the new 3D mammograms are fantastic. They've revolutionized what are called false positives, meaning that women come in and they maybe get called back for extra imaging when it's normal. And so they have to come back for extra imaging and get more views done when in fact it's normal. So the 3D mammogram is almost like a CAT scan, as it cuts the breast up into layers, and it allows us to see what's actually normal and what is not normal. It's great for young women, and it's revolutionized breast cancer. And as of January 1st, it will be covered by all insurances. So women, go get your 3D mammograms.
Thanks, Dr. DiPasquale. Let's take another call. Dr. Line, what's your call for the experts? Dr. Kannan?
Breast cancer can be hereditary, but the percentage of hereditary breast cancers are fairly small. So of 100 patients, if you test them for breast cancer with the genetics, only 10% are positive, which means that 90% of patients, even though there is a family history, will tend to have a negative breast cancer genetic study. You know, the BRCA1, BRCA2, and we actually do about 17 other mutations, which is a very comprehensive test. So every woman, if they are high risk, they start mammograms earlier than recommended, which is the recommendation is at 40, but you can start having your mammograms 5 years before the person in your family was diagnosed, which would be if the mom was diagnosed at the age of 40, you start mammograms at the age of 35. And high risk women, they have their first screening mammogram at the age of 35, and then continue with the routine mammograms at the age of 40. So to answer your question, anybody who's at a high risk, and I encourage all women to do self-exams, because women we still detect breast cancers through self-examinations, and it's extremely important. And most of these tumors being painless, a painless lump is often very suspicious.
Thanks, Dr. Kannan. Let's take another call. Dr. Klein, what's your question? Hello? All right, so thank you very much. Dr. DiPasquale?
Yes, thank you. This is Dr. DiPasquale. So in terms of if a family member, it depends on if it's a first degree family member, like a sister or a mother or even a father, because men can get breast cancer too. Let's not forget that. So if that's actually occurring, then what we suggest doing is test the person with cancer first, if they're still alive, because they are the high risk of having that genetic defect. So if that person does have the breast cancer gene or any gamut of the genes that are connected to breast cancer, then the relative can then get tested for that specific gene. Because if it is your mother or father that has it, you as a child only have a 50% chance of getting it. So we'd rather test the high yield person, which is the person who has cancer, and then test the relative after. But all that said, that means that that relative may then be in the high risk category to start the mammograms earlier than normal. So 10 years prior to that family member's diagnosis when they should start theirs, okay? So again, if the mother was diagnosed at age 40, the daughter would start at age 30, and that would put them into high-risk category.
All right, thanks, Dr. DiPasquale. Doc Talk Live, what's your question for the expert? All right, thank you. So your question was, is obesity associated with breast cancer? Is that correct? All right. I have Dr. DiPasquale to answer this.
Yes, thank you for your question. So, actually, estrogen receptor or hormone receptor breast cancers, and estrogen lives in fat cells. So being obese is a risk factor for those type of breast cancers. Now that said, there are a lot of very thin people who do have breast cancer. So recent studies have actually looked at different types of blood mechanisms in your body, like insulin. So if high levels of insulin are found in people, it's actually called insulin-like growth factor, that can link you to higher rates of breast cancer. So one thing that all women across the United States, across the country, across the world can do for themselves is exercise and eat well. Even a 5-pound weight loss has shown to decrease the amount of estrogen and insulin-like growth factor in your body, thus protecting you from getting cancer.
Exactly. Thank you, folks, for calling in. We're going to be going in a short break for about 5 minutes, but we'll be taking some of your calls off air. So keep calling in. The number to the studio is 972-235-5555. And you are listening to Doc Talk Live, and we have Dr. Kannan and Dr. DiPasquale in the studio.